Dear chairs, dear audience, let me present my PhD research. The title of it is Oral Health of Patients with Eating Disorders. My name is Adrienn Széll. I am a dentist and I am a first-year PhD student. I work at the Department of Prosthodontics. My supervisor is Zoltán Géci, and my scientific methodology supervisor is Adrienn. My vision is to improve recovery rates for patients with eating disorders, and my mission is to assess oral cavity differences between patients with and without eating disorders. So my primary goal is to conduct a comprehensive literature review to identify the oral manifestations associated with eating disorders, and based on the findings, I aim to conduct clinical research to further investigate these observations. So the title of my first project is Investigating the Prevalence of Oral Conditions in Patients with and Without Eating Disorders. Now, eating disorders present a major health concern among young people globally. Recent studies show that the prevalence of eating disorders ranges up to 33% in women and up to 13% in men. 10% of people with anorexia nervosa die within 10 years after getting the disease, and 20% will die after 20 years. It means that anorexia nervosa has the highest mortality rate of any psychiatric illnesses. 80% of patients with bulimia nervosa do not receive treatments because they usually hide their conditions, even though after 6 months, first signs of tooth loss may occur. It means that dentists could be the first healthcare professional to encounter a patient with an eating disorder. Here I outlined the oral manifestations of these the eating disorders. For example, vomiting can lead to dental erosion, or hemorrhagic lesions, or hypertrophic parotid glands. The inappropriate use of diuretics can result in hyposalivation or xerostomia, and extreme diet or nutrition deficiencies can lead to cheilitis or glossitis. My aim is to highlight the dentist's role in recognizing oral signs timely of eating disorder to intervention. So the question which drives my research is, how do eating disorders affect the oral parameters? The population refers to patients undergoing dental visit. The exposure denotes patients with eating disorders. My comparators are patients without eating disorders, and my outcomes focuses on several dental parameters like DMF, dental erosion, soft tissue lesions. And we hypothesized worse results for oral parameters in patients with eating disorder. My clinical implication is clear: early diagnosis of eating disorders through oral examinations. So here you can see my flowchart selection. We started with 9,500 included articles, and after the citation chasing and the selection, we ended up with 66 included articles. Here I summarized my finished outcomes analyzed using mean difference and odds ratio. And here you can see my finished outcomes analyzed by simple mean and ratio. Now I would like to present only my main figures. So the first one is DMFT. DMFT stands for decayed, missing, and filled teeth. It's a widely used dental index in dental epidemiology. The higher the DMFT score, the worse the dental health. So here you can see the mean difference in DMFT scores between patients with eating disorders and the controls. I divided my studies into 3 subgroups. You can see anorexia, bulimia, and other mixed. Other mixed subgroup includes studies where the author didn't divided the eating disorder, so we don't know if it's bulimia or anorexia, it's together, or they investigated another type of eating disorder. So the overall result shows that patients with eating disorder, on average, has 2 more affected teeth. On my second figure, it's about dental erosion. Dental erosion is a type of loss of tooth structure caused by acid, which can lead to sensitivity or tooth pain. Here I also could make subgroups. The overall, the pooled odds ratio was 14.30. It means that a patient with eating disorder has 14 times higher chance to have a dental erosion. And on my third figure, you can see salivary gland enlargement. Salivary gland enlargement refers to the inflammation or swelling of the one or more salivary glands, which can result in difficult swallowing and feeling discomfort. Here I included 5 cross-sectional studies with gender and age-matched controls. And pooled odds shows that patients with eating disorder has 8 times higher chance to have salivary gland enlargement. So here you can see the progress of my first project. Now I am at the grading stage and I started writing the manuscript. So my second project's title is Comparing the Oral Health Status of Patients with and Without Eating Disorders in Hungary. It will be a prospective observational study. So today's cases of eating disorders are becoming more common, especially in developed regions like Australia, Northern and Western Europe and North America, and less prevalence is, for example, in Africa and Eastern Asia. Anorexia has the highest mortality rate of any psychiatric disorders, as I mentioned. That means that, for example, in the US, in every 52 minutes, someone dies because of an eating disorder. 80% of patients with bulimia nervosa do not receive treatment because they usually hide their problems and condition, even though after 6 months the teeth may tell the dentist that there is a problem. So my aim is the dentist can recognize oral signs of eating disorder for intervention. So the question which is driving us, do patients with eating disorder have worse oral parameters than people without eating disorders? Like population refers to patients undergoing dental visit. The exposure are patients with eating disorders. The comparator focuses on patients without eating disorders, and my outcomes focus is primarily on dental erosion, but my secondary outcomes would be, for example, DMFT, periodontal status, soft tissue lesions, and oral hygiene. We hypothesize that patients with eating disorder have worse oral parameters than patients without eating disorders. So my clinical implication is early recognition of eating disorders. So here you can see the exclusion and inclusion criteria. So the inclusion criteria would be for the study group that this patient should be diagnosed by a specialist, and the control subjects are confirmed of not having a risk of an eating disorder by using a questionnaire called Eating Disorder Inventory 2. Our exclusion criteria contains, for example, pregnant women, immunosuppressive and mental retardation, dental professionals and dental students due to their specialized dental health knowledge, and, for example, removable partial dentures because it can make differences in the mouth. So to summarize my project, this study bridges the gap between the oral health and systemic conditions and highlights the dentist's role in multidisciplinary healthcare teams managing eating disorders. And let me end my presentation with my sister's words. In the coming years, it will be the next academic weapon. Thank you for your kind attention.
Thank you very much for this nice presentation. Then we have a question there. Do you have a microphone? No?
Thank you. Thank you for the presentation. So we all know, we're all familiar with bulimia and anorexia, but there was a third eating disorder on your background slide. It starts with a B, some kind of B eating.
Binge eating.
Can you please tell me more about that? I haven't heard about that before.
Yes, binge eating means that a person who eats a big amount of calories in one time, so extreme big. Yeah.
Thank you.
Thank you. Another question there. Can you give it to her? Thank you.
Congratulations on your presentation. I have a question regarding your second project. What age groups are you planning on including in this study?
Thank you for your question. In the included studies, they usually included patients between 13 and 50 years. And after a discussion with an expert from the Department of Psychiatric, we plan to use this age range. Actually, the eating disorders peak at the age of 16 and then again at the age of 45. But if we will have enough patients, we try to make two subgroups from it due to the different dental status, because we can see other things in for example, in a 13 years old mouse and in a 15 years old mouse. So we plan to make two groups, but between 13 and 50. This will be the range of the age.
Thank you. There is another question.
Thank you for this nice presentation. My question is regarding this whole topic. You said that these patients are tend to hide their conditions. And do you have any data or maybe experience in your own practice that if you are the first healthcare provider to see these patients, how high is their compliance or their willingness to see a psychiatrist after you say that I see this is your problem and this can be the dangers of it, and please go and see a psychiatrist?
Yes, we have to communicate with these patients very carefully, and actually we told about this too. Maybe the next step could be this, how to communicate if we find out these things. There isn't enough data about this actually or in the literature, but we plan to investigate this too. So the next step will be this.
Great, thank you.
Thank you.
Hello, thank you for your presentation. In your first study, you were talking about how you're investigating patients with eating disorders. Was there any mention in any of the studies about patients with comorbid, like, psychiatric problems? Because oftentimes, like, psychiatric disorders come together, but then also if they have other psychiatric problems, it probably also affects their teeth.
Thank you for your question. Yes, there were articles that they measure also if they have depression, because they usually are together, the depression and the eating disorder, and we excluded those articles which mentioned more type of mental illnesses or disorders.
Thank you.
Congrats for your presentation, and I recommend only small modification in the title of your topics. It's the prevalence of oral condition. It's a little bit difficult to understand. It's much more easier if you write prevalence of oral disease or the prevalence of oral alteration. Much more easier to understand by the reading.
Thank you for your suggestion.